Okay. So, we are here to educate you and your family about intussusception. We have this lovely brochure for you. But I'm going to read it from those on. So, what we're going to go over is signs and symptoms to look out for, how this disease will affect your child going forward, treatments to expect and what not to expect, things to expect for you and your family, and how to care for your child at home after discharge.
Okay, so I know you might be wondering what exactly this illness is, so I'm just going to start off by giving you, a generalization of what intussusception is. So intussusception will usually occur when one portion of your child's intestine slides into another portion of it. So it's kind of like it is telescoping in on itself. So it kind of collapses in on itself like that. So when this happens, it usually leads to a blockage in the intestine, which can cause symptoms such as severe abdominal pain, vomiting, and bloody stools. So when this happens, babies and children with this illness, they usually have alternating episodes of severe cramping or severe abdominal pain, and it also has intermittent periods of no pain at all. So you might see them being unable to communicate, just in intense pain. They will usually draw their knees up to their chests and cry. And then within 20 to 30 minutes, they will have relief and be able to play, interact like nothing's happening, but then the cycle repeats and they're in pain again. And when this is occurring, some emerging symptoms, so the signs that you would see that you'd know, okay, I need to rush my child to the doctor, to their provider. These symptoms would be a swollen belly, nausea and yellow-green vomit, red jelly-like stools, and a fever of over 101 degrees. All right, and you might also be wondering what effects this illness might have on your child's development. Will it impact them? Will it hinder them? How will it affect them? So, intussusception can potentially impact your child's developmental stages if it's left untreated. This is usually because it can cause severe pain and discomfort, which will usually stop your child's ability to engage in normal, developmental activities. They won't be able to play with other children. They won't be able to attend school. They won't be able to sit and just, do whatever they need to do. They'll be in a lot of pain and they will be unable to accomplish a lot of things. And so, just to keep going with that, the reason that this turns out to be such a hindrance is because a healthy gut usually provides nutrient absorption, which would be essential for your child's physical growth and neurocognitive development. Their digestive tract is lined with millions of nerve cells which connect their gut to their central nervous system.
Okay, and so moving on to treatment. And so we kind of organized it in order of kind of the interventions we'll start with, and then kind of going down the list is if these initial interventions aren't working anymore, and then we'll move on to that. And so starting off, we'll just do administration of fluids, because through that nausea, vomiting, and diarrhea, you're going to have a lot of fluid loss, and hydration is definitely key, especially in our pediatric patients. And then next will be administration of antibiotics, because with that intussusception, there is an increased rate of infection, especially during the treatment, and so we want to prevent that. And then next we'll do a use of nasogastric tube, and that'll go up through their nostril and down into their stomach, and we use that to suction up the bile and then decompress the obstruction. And then fourth, we'll do an enema, and there are two types. There's a gas enema, which uses air to create pressure within the intestine, and it unfurls the intussusception and relieves the pressure. Or a saline enema, which is a mixture of water and salt, and that pulls water from the colon and into the stool to make it easier to pass. And then the last option, and honestly the one we try to avoid, is surgery, and that's only if an enema fails.
So, if your child has siblings or people or cousins that live with you, they might have some social issues going back into a normal environment after this trauma that's just occurred. So one thing you do need to know is that siblings of a child who experience intussusception are more likely to experience it. So definitely keep a lookout for these signs and symptoms of any brothers or sisters or family members that the child may have. And the doctor might order a special diet to help that colon kind of relax a little bit after all that air and saline and all that was in there. So if that happens, it helps to have the whole family eat the diet at home so that it helps the child accept the changes and all these new interventions that are scary. And kind of going off that, this was a medical emergency. We understand that this has been a very traumatic experience for you, and going through this whole process, we just suggest that it might be beneficial for you to reach out to a therapist for you and or your children, just to talk through your experience. Even if they only go 1 or 2 times, it can just be helpful to get those feelings out and sort of get closure on the whole thing.
Okay, and then moving to care after discharge. So just the key with this is keeping up with their range of motion. So we want them to resume their normal activity when they're able to feel possible to do so. And so, because fatigue breeds fatigue, and so getting their range of motion going is important. And then continuing to observe for symptoms of a future intussusception, because obviously if it occurred, they're at a greater risk for it. And then just in their diet, keeping them hydrated, providing them adequate sources of fiber and protein, and then increasing their movements, so promoting walking, and then using stool softeners as needed. But obviously we want to kind of tackle that diet first before turning to medications. And then if the surgical intervention was needed, then with that surgical site, you'll need to look for signs of infection. And so that can include redness, warmth, swelling, and tenderness around the site, or a yellow-green discharge.
Okay. So all of our sources are cited on that, so you can look for those for more information. And if you have any questions, just let us know.
Okay.